In this first tutorial, I'm going to show you how to administer medication correctly with no issues identified during CLMA. This involves the right medication, right dose, right route, right time scanned, and the example I am using is ferrous sulfate. So within my EPR patient's record, I need to go to the Medication Administration tab. A new tab will open and I need to scan my patient's wristband. This will now show the orders due for my patient. So in this example, ferrous sulfate 200 milligrams, I'm going to scan the barcode on the box. This has gone through correctly, indicated by the blue tick on the tick dose section. I can now administer the medication to my patient, and once this is completed, I can sign. In this next example, I'm going to show you how to administer the right medication at the right time. So this first example is ferrous fumarate prescribed, but ferrous sulfate has been scanned. So as you can see in my patient's record, we have an order for ferrous fumarate. The dose is 210 milligrams. As an example, if I had a ferrous sulfate 200 milligram box and I scanned this, an error message will appear. So the error message reads, the scanned medication, ferrous sulfate, is not on the patient's current active profile. So in this example, I would press OK. I would then scan the correct box of ferrous fumarate. I know this is correct, indicated by the blue tick, which would then appear. I can then administer the ferrous fumarate to my patient and then sign. In continuation of the first example, please note that a similar error message will be displayed if a medication is scanned but its administration is not due for more than 2 hours. For example, on screen, simvastatin has been prescribed for this patient, but it is not listed here as it is not due until 10 p.m. If simvastatin is scanned now, a similar error message will therefore be displayed. So in the error message on screen now, the scanned medication, simvastatin, is not on the patient's current active profile. So this highlights the importance of scanning the medication at the right time when it is due. In this next tutorial, I'm going to show you how easy it is to underdose scan a drug on order. So in this example, I am using lactulose oral solution 5 ml scanned, but 15 ml prescribed. Please note that we do not currently recommend scanning liquids, but this is what the CLMA process for liquids will be in the future. So in this first example with my lactulose 5 ml bottle, if I scan this one time, a new tab appears. So in the scan section, it shows that I have scanned 5 milliliters. This also highlights, however, that an underdose has been scanned under the qualifications taskbar. So in order for me to document administration of the correct dose, I must scan this bottle 2 more times. So when I scan this a second time, you will see that the scan dose volume is now 10 ml. And if I scan this a third time, this now removes the tab, and I know I've done this correctly, indicated by the blue tick. I can now administer the medication to my patient and then sign the order. In this next example, I am going to show you how you can underdose on the CLMA system. So for this example, I have a box of paracetamol, which is 500 milligram tablets. So on the medication administration tab for this patient, the dose is 1 gram, 1000 milligrams. So when I scan the box of paracetamol once, This message will pop up on a new tab, which states that the strength is 500 milligram, one tablet. We know the dose is 1 gram. So in order to do this correctly on the CLMA system, I need to scan the box again. Once I've scanned the box twice, this is now correct, indicated by the blue tick. I can now administer the 1 gram of paracetamol to the patient and sign. In this next example, I'm going to show you how to intentionally underdose on the CLMA system if this is warranted. So if you wish to administer a smaller dose than what is prescribed, for example, the patient has requested only 1 paracetamol tablet, you can override the need for a further scan of the medication box. So in this example, I have an order of 1 gram of paracetamol for this patient, but I want to administer the patient 500 milligrams. So firstly, I need to scan the medication box barcode. This will open up a new tab, which shows that I have scanned 500 milligrams, which is 1 tablet. So to override the 1 gram dose, I need to click on the medication line here, and then click OK. I can now administer the 500 milligrams of paracetamol to my patient, and then I can click Sign. You will receive a further warning to remind you that you are administering a different dose to what is prescribed. Please ensure that you click Yes if you wish to proceed. In this next example, I will demonstrate a potential overdose that would be prevented by the closed-loop medication administration process. So on my desk, I have a box of 16 milligram candesartan and a 4 milligram box of candesartan. So on my patient's orders due, I have candesartan dose 4 milligrams. So if by chance I scanned the 16 milligram box, you would receive an error message. So this message states, the tablet is not the correct dose as indicated on the order profile. The correct ordered dosage is candesartan 4 milligrams. So in order to do this correctly on the CLMA system, I first need to press OK. I then need to deselect the medication line in the tick box. And now I need to scan the correct dose of 4 milligrams. So I will scan my 4 milligram box. This is now correct, indicated by the blue tick. I can now administer this to my patient and then sign. In this next tutorial, I'm going to show you how to perform traditional manual documentation of non-CLMA medication. So firstly, I need to tick the tick box of the medication line that I wish to document and administer for, which in this example is an intravenous infusion of sodium lactate. So I'm firstly going to tick this box. This will then show a message in the results column for that medication line. So when I do a single click of this box, this will open up the medications lines administration details window. So this works in the same way if you scan a medication such as a controlled drug, which requires documentation of additional details. You would simply scan the medication and then click its results column as just demonstrated to open this screen. So in this tab, follow the local medicines policy to document the required information. If this was a drug that required administration witness, for example, if it was a controlled drug, you would need to ensure that you administer the medication with a witness and countersign the order by the witness in this box here. Ensure that you also document the batch number and expiry date in the batch number field or in the comment section here. And also make sure that you complete the mandatory site of administration box here with the drop-down menu. If you are unable to administer the medication or the dose requires omitting, tick the Not Given box here and document the reason using the drop-down box here. Once all the doses required have been ticked and correctly administered with a witness present, click the Sign button. So in this example here, I'm going to choose a site, press OK, and then I can sign. In this next example, I'm going to show you how to administer the right route or formulation. For this example, a paracetamol suppository has been prescribed for this patient on the record. If I scan the box of paracetamol, this error message will be displayed. The error message reads, "Failed to convert units from tablet to suppository." So if this happened, I would press OK. I would then scan the exact order displayed for that patient. So in this example, you would scan the correct route, which is the paracetamol suppository, on the order. You would then administer this to the patient and then sign. In this next video, I'm going to talk about a situation in which the medication barcode is not recognized by the EPR. So you may sometimes find that you scan a medication barcode, but it does not yet exist within EPR. If this happens, this error message will appear. The EPMA team will be notified to add this barcode into the EPR system. So in the meantime, you should click OK and document administration of this dose manually. In this next example, I'm going to show you how to support administration of half a tablet. This involves scanning to ensure we have the correct drug, but manually correcting the dose. And in this example, I'm using half a spironolactone 25mg tablet to give a 12.5mg dose. So for this next medication, the dose is 12.5mg, so we only want to give half a tablet of this 25mg strength. So first off, I need to scan the barcode on the medication box. We will then receive a warning pop-up tab stating that this is not the correct dose. I will click OK to acknowledge the warning. I will then left click on the results tab on the spironolactone. I will then change the dose to 12.5mg here. I will then click OK. To ensure that I've done this correctly, I can check this by seeing that the blue tick has now appeared next to the medication line. I can now administer the half tablet to my patient and then sign. In this next example, I will be using 2 strengths of a medication or scanning more than 1 tablet to make up a dose. And in this example, I will be scanning 100 microgram and a 25 microgram levothyroxine to make up a 125 microgram dose. So in this example, this patient is on a dose of 125 micrograms of levothyroxine. So we need to give 2 strengths of the medication for this. So 1 tablet of 100 micrograms and 1 tablet of 25 micrograms. So on my table here, this is my 25 microgram box and this is my 100 microgram box. So I must first scan the 100 microgram box of levothyroxine. Another tab will appear and you will see in the qualified task section that an underdose is present. So I now need to scan my second box of my 25 microgram. So I will scan the barcode now. I will then receive another warning. And in this example, this is saying early/late reason. So please specify a reason why the medication is late. This is just an example in this test patient, so you will not see this message when you do this normally. To see that this is correct, you will see a blue tick indicated on the left-hand side of the medication line. You can then administer the medication to your patient and then sign. In this next scenario, I am going to talk about route of other, or when a prescription does not contain enough information for scanning to work. So for some patients who are on paracetamol, for example, the prescriber may prescribe the medication with route of other. In this case, the EPR system cannot interpret the route. So I have a box of paracetamol here. If I try to scan this box of paracetamol tablets, which is the route that I intend to give, you will see that a pop-up warning tab appears and it reads, the form of the medication scanned is different from the ordered form, and it says other in brackets. So I will acknowledge this warning tab by pressing OK. You will see that the medication line is highlighted in red, and it also has a symbol on the left hand side that is a white cross within a red circle. I need to untick the checkbox on the left hand side. I then need to use the manual process of administering medications. So I will tick that checkbox again. I know this is correct, indicated by the blue tick. I can now administer my 1 gram of paracetamol to my patient and then sign. In this next scenario, I'm going to talk about 1D versus 2D barcodes. So sometimes with patients' own medication, the community pharmacy may have put the label over the box. So on my medication box here, this is a 1D barcode. And on the side of the medication boxes, you will always find a 2D barcode. So if you're unable to scan this, I recommend that you always scan the 2D barcode, and it will allow you to perform medication administration the exact same way. So I'll use the example of levothyroxine. So in my patient's example, I have a 125 microgram dose to deliver. So as I said, if these were covered up and we just couldn't access these or they were damaged, I would then first scan my 100 microgram box, which is this one. A pop-up tab will appear in the qualified task stating that this is an underdose at 100 micrograms. I will then scan the 2D barcode on my 25 microgram box. If the medication is late, as this example, I need to give a reason why. Once this is correct, this will be indicated by the blue tick on the medication line. I will then administer my medication to my patient and then sign.